Hello, this is Athena Jezik, and I'm continuing to work on Karina. We're going to cover the arms in this video. Sometimes you'd wonder where to fit the arms in a full body massage. You can do it from the head and neck, work down and do it. You can do it when they're on their face, work the arms that way, although I personally don't like working the arms in that direction. Or you can just work the arms separately, just however it fits with whatever kind of a flow that you have for the body. So anyway, I'm going to walk around the other side and get to her arm. Putting some oil on here. I'll set that over there, so hopefully it won't fall on you. So we're going to get a little bit of oil. Okay, and I want to show you different ways of stretching the arm as well. So think about how the arm is. The joint is right here, and then there's another joint here, and there's a lot of joints here and in the hands. Elbow's a hinge. This is a ball and socket, just like the leg. So we start distally, with just the hands, working the fingers, similar to the toes. It's all very similar. And this is the massage. This is different now when you work with lymphatic work. You start proximal, or you start close in, and you work distally, which is another reason why massage really doesn't deal with the lymphatic system. It may help a little bit, but just the nature of the lymphatic system and the nature of how you work the muscles is two very different ways of doing it. So I don't know if there's very much lymphatic flow from massage therapy. Okay, so now here, this is just articulating the wrist gently. Now, I like to hook my fingers here and then have the hand fall over that and grab it very, very gently, and then just kind of give it a little stretch. But it's a stretch where you're not yanking on it. It's more like you're pulling the fascia and you're imagining the joints expanding. So it's a very subtle kind of a stretch. And as you practice that more, you can feel the way it stretches up the arm. And sometimes it'll feel like it wants to rotate a little bit. That's just the fascia kind of a little unwinding that it needs to do in order to stretch itself in a good direction. And then you can get back into the muscle. So this is very similar to the lower arm, and then of course getting behind the arm up. There's a bone right along there. You want to go right alongside that bone. Now the inner part of the arm, that's where a lot more lymph nodes are and where veins flow, so you don't want to go too deeply in the inside of the arm, and you want to be careful in the elbow as you are in the back part of the knee. And this little pumping is just a little pumping of the nodes that are in that area. Then moving up, bicep, tricep, we're going to be deltoid. We're going to come up, and again, inside the arm is where a lot of smaller structures are, so you want to be more gentle on the inside, the nerves, the veins, the lymph vessels and nodes. And working around there, you can come under, lifting the shoulder, working around the back of the shoulder, getting into the shoulder socket, and then just doing the lifting and kind of puffing it up. pushing it up again. And when it feels pretty good, you can also tie it up into the neck. It feels always good to do that because the top of the shoulder blade is so closely connected into the shoulder socket, and it's all tied in so close. It's kind of nice to finish up going up into the neck, even though that's not really part of the arm. And then we'll go to the other side. Same thing. Okay, so I'm down at the fingers. Going to give that wrist a little pull, little stretch. Not really pulling the bones apart, but pulling having them feel that the connective tissue is what's being stretched. The connective tissue that's holding those joints together. And then we go through the fingers. Work them. Remember, if you're doing this on your friend or you're just learning this technique, go very slow because you want to feel every little thing. And then as you practice more and more and more, hours and hours and hours on a lot of different bodies, your hands will get very trained to this. You can pick up things immediately. Along with other things that begin to happen, you can begin to kind of sense things off the body that's happening. Sometimes I'll put my hand on somebody and I'm not really sure why I'm doing that, but the comment will be, "How did you know?" I don't really know how I know sometimes, other than I think at some level I pick up a lot of what the body has to say to me. And I work really hard to pay attention to that kind of intuitive voice that is oftentimes overlooked. And I'm doing the same thing over here with the work and up around the joint. It's the same kind of thing. And then I'm going to work up into the neck as well. One thing you want to remember is you want to do the same thing, basically the same thing on each side. Yeah, okay. And I guess since she's exposed like this, we can just do a little bit in the stomach. The liver is right here. I like to just drain the liver a little bit, which is just kind of a pumping thing, and moving it that way. It's a little more of just manipulating the organs, feeling the hardness. Sometimes it feels the liver will feel kind of hard. Sometimes it feels very fatty. Sometimes it feels a little displaced. But I think that, just giving a little bit of massage to the liver is nice. And then you can also feel the motility. It's a movement in a three-dimensional way. And just see if it's got that movement. And then you've had the stomach and the pancreas over here, so it's worked a little differently. Spleen. You can work up. I'm actually not really opening the nodes in the armpits, but I'm softening it's sort of a lymphatic thing, but I'm not really doing the lymph work. I'm more, in this case, feeling for the organs and the motility of the organs than I am in the fluid. And then we can go up from the ascending colon and keep keep that stimulated, that peristalsis stimulated. And of course the bladder, you can work the bladder a little bit, the small intestines. And then something is kind of interesting, you know, everything tends to, well, the lymph will flow in the quadrant direction, but then the intestines and the tract flows in this direction. So to stimulate that sometimes, what you can do is, again, place your hand long on that, meld the hand on, so just very lightly, and then let yourself go a little bit deeper until you feel like you've connected and melded into the body, melt into the body. Don't really know what that word is. And then you want to back out little by little until you feel like you're just kind of holding on with that magnetic hold. Then with that, then you want to take your hand and twist it in the opposite direction. It's flowing this way, but you want to twist it the opposite way, which is actually counterclockwise. But you're not like down there moving organs. You're really moving just the skin and the fascia on top of the organ. Any kind of movement of the organ is going to be made from that top layer. And so the touch is very, very light, but you're stretching the skin and some of the very superficial layers. And it goes quite a way. It's actually pretty amazing. So you just want to hold on with that magnetic feel. And then just let go real quickly. It's a rebound. And that will sometimes, it snaps back, and that will help to just kind of relax things down. I like to do that when I feel a lot of tension in the abdominal cavity. Okay, so that's, always remember if you're working this, you want to go clockwise. Okay, there we go. Thank you so much for watching. Karina and Athena.